Hello, everybody. We're going to talk about oxygenating tumors. And as we always say, an oxygenated tumor is a happy tumor, or maybe better termed, an oxygenated tumor is a sad tumor because it's going to be a dying tumor. So if we can oxygenate cancers, the chance that we can help kill that cancer is going to be better because cancer tends to thrive in a hypoxic environment. And we've talked a lot about the metabolism of that and how it uses lactic acid through glycolysis in a hypoxic environment. That's how cancer tends to grow. So if we can oxygenate cancer, it could be better. And we've had some videos that I've done on exercise. We'll talk a little bit about that tonight. How do we oxygenate a tumor? So I broke it down into a few different steps here. Number one is simple exercise therapy. So if we are exercising in a way that's not causing hypoxia. So remember we talked about in our exercise video, we don't want to exercise to the point that we're just completely exhausting ourselves and we're creating hypoxic areas in tissue because we're expending all our oxygen on muscle contraction. So there is a balance in exercise that we want to exercise to the point that we increase circulation and we increase oxygenation, but we're not utilizing all that oxygen because we're fatiguing ourselves to the point because we're trying to build muscle or run a marathon. So I'm not an advocate of trying to do marathon running while you're dealing with a cancer. I think you're better off oxygenating your tumor through a good mild exercise, lifting weights, calisthenics, using barbells, dumbbells, very good exercise so you're not creating this hypoxic environment again because you're fatiguing yourself out. So exercise to the point of you're utilizing your muscles, you're keeping muscle tone, you're huffing and puffing a little bit, but not completely fatiguing out. So that's simple exercise therapy, and that will help oxygenate tumor because it's increasing circulated oxygen because you have that increase called for oxygen, you're breathing heavily, and you're getting some exercise increasing oxygen. The second is what is called EWOT therapy. EWOT is short for exercise with oxygen therapy. And we really have to separate EWOT therapy into two different types. This would be called simple EWOT therapy. So they're using an oxygen concentrator here. So this is an oxygen concentrator. And typically, this oxygen concentrator typically goes up to 5 liters of oxygen. There's some bigger ones that go up to 10, some that go up a little higher, but this particular brand here is probably 5 liters. And this person has an oxygen mask on, and they're doing some sort of exercise. The exercise is regardless of what type of exercise you choose. So you could go on a treadmill and do this. We used to do a lot of EWOT therapy in our office. We had several treadmills. We had several stair steppers. I think I at one time had 6 or 7 of these little oxygen concentrators in our office. People had their own cannula and their own face mask. We'd keep them in a file for them, and people would come in. This is when we saw a lot of local people for brain-based therapy. So this is a big piece of our brain-based therapy program for people with any kind of early dementia, kids with any type of ADD, ADHD, people with fibromyalgia, Lyme patients. Exercise with oxygen therapy increases the blood oxygen faster than using just regular exercise. So this would be considered maybe a step up from regular exercise because you have a concentration of oxygen that you're breathing in. The next form of exercise with oxygen therapy came out just a few years ago. It's called LiveO2, and this uses oxygen concentrator that's a little bit stronger oxygen concentrator and fills this bag So it's this great big oxygen reservoir that's on this stand here. It's a great big giant bag. This is filled up first, and then you are doing the same thing. They're showing these people on bicycles, but it could be a treadmill, it could be a stair stepper. They could use multiple oxygen concentrators in unison to give a greater concentration of oxygen that that person's breathing in. This is more of an advanced exercise with oxygen therapy, and research has shown that it works better than a simple version like this. So this would be the next step up. Really, when you talk about oxygenating tumors, though, all the studies on oxygenating tumors are not with EWAT therapy. The studies on oxygenating tumors are with hyperbaric therapy. There's a big difference. There's a big step between EWAT and hyperbaric. I would say EWAT, could a person with cancer use EWAT? Why, sure. If you have access to an EWAT system like a Live O2 or even oxygen concentrator, using it with some sort of exercise, go for it. That's probably better than simple exercise. The problem with that is it's kind of clumsy and it's not really comfortable. Whereas we're just getting out and getting some regular exercise and getting outside doing that, getting out with friends doing that has some advantages. You got to think of what you're going to stick with also. But far greater in oxygen concentration to the tumor itself is the hyperbaric therapy. So hyperbaric therapy is what all the studies have been done with. Now, I know there's been some studies that have shown that hyperbaric therapy hasn't really helped certain cancers. Most of them that have come out that are independent studies have shown good help with cancer. The problem with hyperbaric is the same problem with any of the other oxygenation techniques, be exercise or anything, is that you got to stick to it on a regular basis. So we have this hyperbaric chamber in our office. Well, why didn't you do it on me when I was there for 2 days? Because if you're not going to do it on a regular basis, 2 days of doing hyperbaric oxygen, it really isn't going to make any difference in a person's life. So we want to do something that's going to make a difference in your life, and doing 2 days of it is not going to be that thing. This one here is a 23-inch diameter tube. This is an in-home unit that OxyHealth makes, and we actually have the ability to get a rental program for people if they want to do that. It's kind of pricey. I think it's about $2,000 a month or something like that, or $1,500 a month, but it's a nice unit to have in your home. Believe it or not, a lot of people use these in their home, especially Lyme patients or people with any concussion issues. It's really big in the football industry right now. Professional football players are buying these like crazy and using these to protect their brain after workouts and after games. This is something they can travel with in a hotel room. It packs up into a bag type thing about the size of like a massage table, and it's fairly easy to use. This isn't the whole of it. It's connected. You can see this piece. You can connect it to an oxygen concentrator, or you're just connected to the pressurization tank that pressurizes it. And this is what really, again, all the studies are on for cancer patients in improving the lives of cancer patients and survival and oxygenation of tumors. How often would you do this? It's recommended that you do it daily for an hour, 5 days a week. So you have to either have it in your house or have a clinic near you that you can go in and do this. We have some local patients that come in and do hyperbaric, and are we getting success with them? Yes. Is it because of the hyperbaric? I have no idea. That's not the only thing that they're doing. They're doing other therapies while they're here. They're doing the right. They're doing everything else you guys are doing at home. So it's very hard to quantify what's the cause of a person's success in their treatment of their cancer or other disease when they're doing multiple things. Okay, so that's a question that somebody had about exercise with oxygen. Would I recommend it? Yes, but I'd start with simple exercise. This is a way to go. These things are relatively inexpensive. You could probably buy them used for a few $100s. These units are a couple $1,000s. I doubt if you'll find them used. They're fairly new on the market. And then, you know, a full unit like this is 25,000, but a full unit like this might be 12,000, and you could rent them for less than a couple $1,000s a month. So that's the difference in price. Exercise like this is free. Buy a set of dumbbells, and you can do this on your own. And this has some benefits. Simple exercise has benefits over EWOT and over hyperbaric, in that you're doing hyperbaric, you're not increasing muscle tone. You're doing EWOT, the only thing you're increasing muscle tone, because it's almost always a lower body exercise. And if you have any knee problems or hip problems, you can't do this. Um, and this, you can choose what exercise you're doing to help increase muscle tone, which is really improvement, you know, and important, especially with cachexia issues that we've talked about on some other videos too. Okay, so I am going to unmute everybody. You are unmuted, and where I'm getting feedback here. So, any questions?
This is Carol in Wisconsin. Does a person go in that thing, or how does that work?
So the hyperbaric, are you talking about this thing here?
The other one, the blue one that the football players use.
Yeah, you go in this. So this unzips, and you climb in there and lay down. And you feel, so this, the negative of this is it's not for people that have claustrophobia. And that can be an issue. It's not for people that have sinus issues. I can't go in it. But it is, you go in there, you feel like you have to pop your ears and maybe chew some gum for the first couple minutes, and then you don't notice anything. You can lie in there and read a book. You can lie in there and use your computer. You can use your iPad. You can listen to music. There isn't anything electrical in there that would interfere with anything electrical that you have on your body. It's great for people that, you know, are not really horribly ambulatory. They can't get around very well. They can just climb in there and take a nap. That's what a lot of the football players that I know do. They just get in there and they just go in there and take a nap for an hour, and they do this an hour a day. It's extremely beneficial for your pain. I have a friend who's a doctor who had a patient who had Alzheimer's, where he couldn't remember his kids' names and his grandkids' names. His wife was freaking out. They bought a chamber. Actually, I think it was this one right here that they bought for their home. Within a week, the wife called the doctor who I know, and said, "You will not believe my husband. He's like a different person. He's over playing ping pong with the grandkids right now." So
wow.
make a giant difference for your brain, and dementia issues and Alzheimer's issues. That's probably the biggest use of it right now, is with concussive, post-concussive disorder, and any kind of brain fog, because it can make a big difference pretty quick.
Okay, thank you.
Dr. Connors?
Yes.
A different subject, but goat's milk. I'm not supposed to be on cow's milk, but I'm really having a craving for milk. Is goat's milk an alternative if I just don't go overboard, or just completely stay away from dairy?
So there's reasons why a person will be off of dairy would be they have a sensitivity to lactose, the sugar in the dairy. That's not why we have you off dairy. Second reason a person will be off dairy is they have a sensitivity to casein, the protein in dairy. That's not why we have you off dairy. We have you off dairy because dairy stimulates, mTOR stimulates the KROS pathway, stimulates growth hormone pathways, and goat's milk does the same as cow's milk. So if a person there's people that will have a sensitivity to dairy, that's why they're off dairy, and they may not be sensitive to the same casein protein, goat's milk, but that's not you. So goat's
Okay.
milk will still stimulate the growth pathways. So that's where we push people towards try to use the nut milks, the coconut almond mixture. That's what I use. But yeah, but again, everything is within moderation. If you're just going to have a little bit of, a little bit of goat's milk is, it's a balance of life, really. So, you gotta define what moderation, I guess, is. But
Okay.
yeah.
All right. Thanks.
Any other questions? All right. Well, thank you everybody for being on. Make sure that you email any questions that you have, and please continue to utilize the Facebook page. Post anything and post yummy recipes on there that you might want to share with other people, and any positive feedback that you could give to share with other people as well. We try to keep that a very positive experience for everybody. So I will see you next week. Bye-bye, everybody.